Good day to all of you. Thank you for being here and for your interest on this topic. I know these things are not new. They are not new to anybody, but really the big challenge is to find ways to disseminate this kind of knowledge is very important. My expectation is that finding ways to work together, we find the inspiration this agenda forward. In the first part of my presentation, I will share the rationale for a public call for equality early childhood, regardless of socioeconomic family background, social status, or race. Present key findings also and recommendations from the study framing preventive measures for children's adverse experiences. Research from different scientific fields are compelling, showing that the foundations of adult health are laid in early childhood and before birth. Equality early childhood is one of the most important social determinants of health. It's tightly related to the other social determinants such as income, level of education, where you work, where you study, etc. Everything is important, but we have to remember that everything starts in the very beginning, the first years of life. So a lifespan perspective allows us to understand how parental socioeconomic status defines income and living conditions in general, from the moment the child is born throughout his or her development, through the adolescent years regarding education and health behaviors, and then work possibilities, work potential, health status, and more importantly, defines living standards and health. The research from neuroscience and human development shows the significant impact of the sociocultural environment on a child's development. For example, we know that in Canada, less than 5% of children are born with clinically detectable limitations to their development. But by school age, these early vulnerabilities goes up to over 26%. How do we know this? Is through the early development instrument. These days, kindergarten teachers assess children's development on scales related to their social, emotional, cognitive, and physical development. Furthermore, in Canada, there is a countrywide data showing the relevance of this early development. And what we have learned is that more than 1 in 4 children with early vulnerabilities. And also these vulnerabilities are very much related to levels of income. You see in the chart on your right how most affluent sectors have less, and unfortunately this grows as income declines. So what is this important? Because we see that early experiences make a big difference. The brain develops as a result of positive interaction with responsive, nurturing parents and caregivers. Because of the extreme malleability of the developing brain, we know that the quality of these relationships in the early stage of life make a big difference because they contribute to the developing 2 key assets for cognitive and socio-emotional development. And these are attachment and self-regulation, which are also the basis for infants' mental health, for health and well-being. We know, for example, that there are sensitive periods of neurobiological development. Sorry. We see in the graph that through a stimulation from the environment, the first two synapses start even before birth, and these are the sense synapses and the coping one. The coping one is the pink line, and we see how then the language and the higher cognitive synapses or functions starts later, especially the cognitive synapses is based on the quality of the development of the first three, the senses, coping, and language development. Furthermore, we note also how brain development relates to the increase in neuron connections or synapses. Houghton Loescher in the late 70s studied comparatively the development of connections from birth throughout childhood, 6 years, and for example, throughout also adolescence. And what he found is that thanks to the stimulus the child received in the early days, the density of these connections are abound, and then there is a pruning process because related to how the child have to focus on more specific things, then happens the pruning process. And this is mainly based in a use it or lose it dynamic. So the specific necessary connections most used are the ones that remains. Also, apologies for being very schematic presenting these things, but a way to better understand the brain development dynamic is through epigenetics. Is a science developed during the past 10, 15 years. And we know epigenetics is the study of changes in the organisms caused by modification of the gene expression rather than alteration of the genetic code. Sounds complicated, but what is easier to understand if we think that in the interaction with the environment, our individualized genetic code change depending on the quality of their interaction, and the genetic code is turned on or off. Certain codes are turned on, certain others are turned off, depending on the experiences. The way the genes are expressed, then we know very well, depends on the environmental factors. And we have to consider maternal lifestyle and specific prenatal environments to the influences from the broader socio-cultural environment. These influences are especially important during early life, but the dynamic exchange between the environment and the gene activation or deactivation continues throughout the lifespan, thanks to what we call now brain plasticity. Brain plasticity is another key concept, but in very simple terms, is the ability of the brain to change with learning, and depends again on the quality of the stimulations and on the kind of connections that generates in the developing brain. And genes and experience determine the pathways that are strengthened and those that are eliminated. And just to provide an example, not because you have any, you identify that you have a gene which could be causing some kind of mental issue, it means that you are going, this gene will manifest. It depends on the quality that this gene is kept, and that's what we this knowledge allows us to work towards interventions. Putting this knowledge into everyday life now. I brought this picture on purpose because it reminds me of someone I, I have met in my life and who, despite of very rough living conditions, he and his wife managed to raise 3 children in a very, very nurturing and healthy environment. And one thing that we learn through all the science that now is there is that love and support from parents and caregivers is really necessary and important to learn, for children to learn how to respond to stress. We need to recognize that stress is part of our everyday life. We have, in the first place, positive stress, which are these short-lived experience. Let's think in terms of the child, the first day of class. We also have tolerable stress. This is more intense, but still short-lived experience, such as the death of somebody dear in the family. The problem is toxic stress. And toxic stress is this intense, adverse experiences over a long period of time suffered by a child from those who should be caring for them. So, and the total lack of control that the child has of this creates a chronic activation of the stress system. This is clearly demonstrated in the Adverse Childhood Experience Study. Key findings from the A study conducted by researchers in California between 1995 and 1998 reveal the strong links between adverse childhood experiences and the presence of a range of health issues throughout the person's life. And over 17,000 people were fill out a survey, and they were middle-class citizens. And what they found is they identify different kinds of adverse experiences, and these were clustered in different expressions of abuse, neglect, and household dysfunction. And what they found is that the higher the scored, more likely the health will suffer throughout the life, and even life expectancy is shorter. And this has been replicated in many other countries now, and the evidence is coming again and again. So, adverse experiences really leave a mark on a child's biology, because what did happen is that these adults made a retrospective recount, and also is true is that there is this chronic activation of the stress system that it might alter the brain physiology. And so what happens if this is chronic? What it happens is that also leads to a chronic low resistance to stress, increased exposure to unhealthy behaviors as a sort of coping, and more vulnerable immune systems and premature mortality, because this is important. Even in the cases that there were not so-called unhealthy behaviors, even in those cases, people had a number of chronic diseases far higher than what they should have. So another thing to consider, which is very important, is that this is not a deterministic dynamic, because the positive interaction and experiences are also likely to counteract this strength, thanks to the brain plasticity dynamic we talked before about it, and also prove the need for interventions and the need for available support services. We know that adverse experiences occur at all levels of the social strata, but the problem is that low socioeconomic status adds extra barriers. And especially when we are living in a very competitive social economic environment, which causes this chronic stress. How do we overcome this? Low-income earners have shorter life expectancies and more illnesses. This is evidence, epidemiological evidence cannot deny this. And really a support for this agenda is the fact that children don't choose the family environment they are born in. So the question and what has led us to this kind of research is how can we provide more supportive, nurturing environments for all children to thrive? This is the big question. So it was the reason for conducting the study, framing preventive measures for children's adverse experiences. The aim was to explore strategies and effective practices to prevent and or overcome adverse experiences in early childhood. We adopted the life course perspective on the relationship between social determinants of health and population health status, because as we see, this has a big influences throughout the lifespan of the person. The research involved two stages. The first stage included a document analysis and four key informant interviews. And the second stage was participants' interviews with 22 frontline service providers from the healthcare and social services system. So the first stage was a documented analysis, which is a relevant qualitative approach to learn how specific documents, the role that specific documents have, how the institutions work, and especially their priorities and the values they work with. We directed our research to policies and protocols dealing with child protection, although we were very much aware that this was very much just the tip of the iceberg, because we know that more likely there are many cases that remain unnoticed within the privacy of the family environment. For the sake of time, I will just say that there was a systematic document search between 1998 to 2013, where we see the changes, very many changes, especially generated by influences and cases that were going on. Here we have the critical cases which have been reported by the Office of the Child and Youth Advocate, starting with the Turner review. This is the most influential critical event was Zachary Turner's death in 2003. Due to the parents' identities and the tragic circumstances that surrounded the case, this acted really as a very critical incident within the child protection system and generating many other significant changes, both in the protection system and also in the dealing with the many other cases that were going on, and they have been reported. This is a group of documents that came between 2006 and 2013, but right now between 2013 and 2016, there are 3 more. It shows really how children might be falling through the cracks of the system. And this is what we learn. We learned that there is a long time involvement of these families with the child protection system, and especially that the parents' history shows also evidence of adverse experiences. Internally, there is one of the issues that was identified was poor communication between different service providers involved in these cases. And what I find more seriously is the fact that there has been this systemic tendency to work with one-size-fits-all approach, which it doesn't work well with the complexity of human beings. As a consequence of a very stressful environment, there is an additional problem, and is that especially social workers has a very high turnover in their work. Summarizing this stage, it was evident in our analysis the high complexity of the issues at stake, and some of the recommendations were especially the need for a proactive, comprehensive approach considering the complexity rather than a crisis-driven approach. A client-centered perspective rather than this one-size-fits-all approach. And a structural family focus rather than seeing the child isolated from the context. And then this is very important too when the crisis occurs, because life is a puzzle and life is uncertainty. We need flexibility and deliberative processes and a learning from errors approach rather than the blaming culture, which have been more common inside the system. In the second stage, we conducted the interviews with frontline workers, as I said, from healthcare services and social services as well, both from government and community agencies. The main research objective question how the different frontline workers saw the connections between adverse experiences and the social environment. And of course, the thing that they mentioned the most were adverse family situations, especially related to economically and culturally deprived environments. So this is very much related then to social living conditions. And also, as a consequence comes parents' poor physical and mental health. And one thing that has been increasing during the latest years is being parental addictions. Of course, this affects parental skills, and it usually related to their own adverse experiences, generating these environments generates developmental delays and adverse outcomes in children. And what we have then, unfortunately, we haven't been able to tackle the fact that we have an intergenerational cycle of adverse experiences. As shown in this slide, considering the complexity of the issues, necessary changes, demands, collaborations, and commitment of everyone involved to enhance the ability of mental health services for parents and youth, supporting parents to overcome the structural living conditions they live in a non-judgmental way, so we don't push them away. Eliminating also waiting lists for essential services for children, especially language therapists, is very much a critical issue in the system. We need to prepare the system to address differential needs in assertive ways and facilitating the navigation of the system. We have a lot of bureaucracy, and it's very challenging to navigate the system when you have complex needs. So We also need to have a stronger professional development training through interdisciplinary collaborations, increase collaborations between the school system and frontline professionals. These were the priorities defined for intervention. I want to highlight that the adverse family environment, most participants suggested compensatory programs and interventions, but the most common was the need of universal childcare systems. And on this regard, we only heard positive comments from Daybreak about Daybreak Family and Child Center. It is the only, unfortunately, it's the only supported comprehensive childcare service in town, available for 40 children or more or so. But it's important that, because this service includes not only attention to the child and to the needs of the developing child, but attention to the parents and attention to the environment. And they do this in a very non-judgmental way. That's what we heard about this particular service. To conclude my presentation, I will outline a summary of recommendations to orient action. And trying to organize the complexity of suggestions we received, I framed this with the ecological approach. These themes are clustered in the different levels of influences, from the microsystem, where we see the child and the family background, the connections they have with the professional practice and services would be the mesosystem. The exosystem would be the broader community, networks, and facilities. And at the higher levels, we have the socioeconomic and political environment. From our participants, we heard suggestions related to the different levels, and often they mention, they might mention all of them, include all of them. So it was a way to frame these recommendations. At the microsystem, or in the child parent's background, with different expressions, practically all participants mentioned parenting educations and skills. Especially some people, some participants emphasize individual responsibility, but also many of these participants express the need to emphasize this social responsibility, more structural supports to overcome structural barriers that these parents face. And from these participants, the main recommendation was approach parents in a less judgmental way. While some participants also recommended to engage with the family in strategies to overcome existential and financial barriers. And the other thing was, okay, the environment is not so facilitating. Let's think really in child and early learning supports available to all children, which is a very important thing to consider. We know, and this comes from research, that investment of 1.4% of GDP in a smart family policy would reduce child vulnerability from 29% to 10%. So this is significant. It doesn't mean, as I said, we are complex human beings, but with a small investment, we might be doing wonders to reduce. And this is what it has been done, for example, in Scandinavian countries. With regard to the mesosystem, arguments expressed by participants included professional practices and services. They should be more interdisciplinary, and also working more in terms of connecting better with the educational system, with quality childcare, with a supportive school system. The lack of investment in Canada, for example, in early literacy, is responsible for more than 3 million low literacy adults in Canada. And this is about 90% of the population. This should be an urging concern in our policies. Also, the need, it was recommended the need for professionals to be sensitive to signs of stressful family environments and its consequences. At the level of the mesosystem also, as we said, we listen, we heard again and again about the need for enhancing collaborations, multidisciplinary teams, networking. And this cannot be just left to the initiative of the workers, but because they might have enough in their plate. There is need of regular meetings and forums to connect people and to generate these spaces for dialogue. So in other terms, we need more institutionalized networking structures, more interactions between researchers and frontline workers, and also very important, more community consultation. We need to bring the parents, we need to bring the community to discuss these very important issues. Leadership, more champions is another big recommendation. And at the level of the primary healthcare system, we need more integrated and more of a one shopping stop, because we have to remember that for citizens living in critical environments, they might not have a transportation, and to be using different services and going around town is a challenge in itself. So at the level of the exosystem, we are talking about the quality of the societal networks. We need to raise awareness about the importance of early child development. And this is not only through every service provider, but also government officials, policymakers, the media, and the general public. Especially because we know, they said, that more public awareness translates into an increased socio-political will. And this is the important thing. With regard to the macro system, just a couple of participants suggested actions related to the wider socioeconomic and political context, such as the need of thinking health in terms of an all policy approach. Health in all policies approach. Health shouldn't be restricted to the healthcare environment, but should be present in every policy we design, because everything is interconnected. That was the argument they used. On purpose, this framework from the World Health Organization, because it identifies how the socioeconomic and the political context relates to hierarchies and the differentiated distribution of material and cultural resources, which creates stratifications in societies and exposures to negative social determinants of waste. Oh, I would say negative exposure to the different social determinants of health, which means that working possibilities, low income, low levels of education, very few occupational opportunities. So everything is related to this issue. And also, living conditions define individual lifestyles. So everything shows is interconnected. We cannot think about, and we cannot blame individuals if all they have seen throughout their life, in their environmental, in their family context, for example, has been negative. We know that people who goes to takes care of themselves and are very much integrated is because they have learned that from their environment. And parenting skills are also learned skills in human beings. So this is why it's very important. So to just the final slide with a big thanks to all of you is it takes a village to raise a child. This is not from me, this is an African proverb. And somebody twisted around in a conference and I said, oh my God, this is also true. It takes every child to raise a thriving village. And I will leave you with that message. Thank you.